and today I'm going to explain to you about the radiofrequency disc decompression, laser disc decompression and RF ablation in disc prolapse. So as we age, right, the skin will develop wrinkles, the heart will become weak. Similarly, the spine will also degenerate. Due to age-related degeneration or due to some sudden strain like sudden bending, some fall, some trauma, long time of driving, long-term desk job can lead to the disc in between the bones coming out and pressing on the nerve roots. This can cause strain and swelling to the nerve roots which will cause radiating pain. If it is in the back, it can cause radiating pain to the legs. If it is in the neck, it can cause radiating pain to the hands. It can cause neck pain and back pain also. In patients wherein the size of the disc is not very big, those patients who are not having any neurological deficits, no bowel bladder dysfunction, those patients who want to avoid surgery initially, very old patients who are not going to be fit for surgery, for them this is a very good option. So for this procedure, no fasting is required. We can admit the patient under day care wherein the whole process gets completed in around 4 to 5 hours, or if the insurance case, the patient needs to stay for 24 hours. With respect to what are the prerequisites before doing this procedure, first thing, the patient should not be on any blood thinner medications like Ecosprin, Clopidogrel, Apixaban and many other blood thinner medications. Minimum 5 days of stoppage of these medications is required before planning the procedure. No need of fasting. Also, no other blood tests are required for this procedure. Once you are ready for it, we can admit you. We'll shift you to pre-operative area where basic patient preparation will happen, like dress changing, putting the cannula and also taking your blood sample for PRP GFC therapy. Once the blood sample is ready, we'll keep it for retraction and we'll be spinning it in a centrifuge machine to separate the plasma, that is the platelet-rich plasma. Once everything is ready, we'll be shifting the patient inside, placing them on the stomach on the OT table, and we'll be cleaning the area where the injection has to be given with betadine. We'll be marking the area and under CM guidance, that is an X-ray kind of machine, we'll be putting the needle exactly at that level where the disc has come out. We'll be giving radiofrequency energy through the needle using a probe, and also we'll be giving plasma through the same needle. The radiofrequency waves will help in shrinking the disc by 2 to 3 mm, and also it will help in reducing the swelling around the nerve roots, which will help in slow reduction of the pain. Once the procedure is done, we'll be putting bandages at the place where the injection has been given, and we'll shift the patient out of OT to an area which is known as daycare or recovery, where patient will be strictly observed for around 3 to 4 hours. So initially post-procedure, we expect around 30 to 40% of pain relief. For the next 15 days, you have to take care. Like if the procedure has been done for the C-spine, you have to wear a soft C collar. If it has been done for the back, you have to wear a lumbosacral belt. So while traveling, while walking, you need to wear the lumbosacral belt. Otherwise, while sleeping and sitting, there is no need. For 15 days, you have to take care, like no bending, no heavy weight lifting, no sitting down, no lifting kids. Two-wheeler and staircase you need to avoid as much as possible. No gymming, no exercise, no physiotherapy. Along with supplementary medications over a period of 15 days, we can expect around 50 to 70% of pain relief. So immediately post-procedure, the patients might feel some tingling and numbness in the hands or in the legs. There might be some heaviness in the legs if the back procedure has been done. Also, after 3-4 hours, if you are trying to walk, you might feel some imbalance, but this will settle in 24 hours. This is procedure-related tingling numbness which settles in 24 hours. The tingling numbness that the patients are already having before the procedure because of the nerve root irritation, that takes some time to reduce. During the procedure, when we are putting the needle, the patients might feel some shock-like sensation in the leg if the back procedure is being done, or in the hand if the cervical procedure is being done. It will last for 10-15 seconds and it will slowly wear off. No need to worry, no need to panic for that. Also, the advantage is no major cuts, no stitches, no major incision, no fasting required for the procedure. So at least we need to see for 15 days post-procedure how the patient has pain relief. If the patient takes care, has good lifestyle modifications, definitely we can expect a pain relief period for a good amount of time. In the future, if there is no pain relief, or if the pain increases, or if the disc prolapse increases in size, patient develops any neurological deficits or any bowel bladder dysfunction, which can absolutely happen in 15 to 20% of cases, because definitely the aging process is not going to stop. In such cases, we might have to think about surgery. But until then, 80 to 85% cases, this is a good option for good pain relief and also for shrinking the disc which are not much bigger in size. We do these procedures every day. Until now, we have not faced any major complications. But definitely any procedure, it holds 1% of risks, that is the documented complications. Sudden giddiness, sudden fall on the table, sudden anxiety, all such rare issues can develop. The BP sugar fluctuations can especially happen in hypertensive or diabetic patients. That is why it is recommended that before the procedure, the patient takes their regular hypertensive and diabetic, or even if the patient is taking thyroid medications, all these medications are to be continued except for the blood thinner medications. With respect to immediate post-procedure care, please take 1 day rest, no driving for 1 day, since your leg or your hand can be numb depending what procedure has been done for you. The next day, you can remove the bandages and take a shower. You will be provided with a discharge summary in which all the instructions will be clearly mentioned, and the medications which you need to continue for how many days also will be mentioned. In case of any allergies to any medications like itching, rashes on the skin, immediately stop the medications, contact the doctor, or if required, even you can reach the hospital. This procedure also can be done for fractures in the spine which are not surgical, which are not compressing the spinal cord but causing severe pain. The procedure can be done wherein whatever inflammation is there due to fracture, the radiofrequency waves will decrease that inflammation. Post procedure, the patient has to take absolute bed rest for 6 weeks, and we'll be also adding some bone strengthening medications, bone strengthening injections. If in the future the pain does not reduce, or if the fracture increases, starts compressing the spinal cord, some weakness starts developing, bowel bladder dysfunction starts developing, then only there are chances that the patient might need to be operated, might need to be fixed for that fracture. Like any joint in the body which can undergo degeneration, which can undergo inflammation, similarly the spine also has some joints which are known as facet joints, which will be joints between the two vertebrae. Due to wear and tear, due to degeneration, these facet joints can also get inflamed, like the joints in the knee will get inflamed. So radiofrequency procedures can also be done for these joints, wherein we put a needle and give radiofrequency waves and decrease the inflammation. So depending on the size of the disc, we can go for radiofrequency ablation or we can go for laser disc decompression. So we have two machines which are available with us, which will deliver the energy at different temperatures for different time limits, which will help in shrinking the disc. Depending on the type of prolapse and depending on the amount of prolapse, as a doctor, as a neurosurgeon, we can decide whether we have to use radiofrequency or laser disc decompression.